So if you're looking for online psychotherapy for help with anxiety and for help with agoraphobia in particular, then I invite you to go to my website and learn more about the online therapy service that I provide over Skype for working with anxiety and depression, and especially for helping people who are struggling with agoraphobia. This is one of my particular interests. People suffering from agoraphobia are usually not able to leave home, and so an online therapy option is very convenient and sometimes very necessary. It's the only choice available for getting the help that you need for overcoming this anxiety disorder. So whenever you're looking at online therapy options for agoraphobia, you must make sure that you are able to use Skype because that will enable you to see each other. You must be able to see each other in order to establish the correct level of communication necessary for psychotherapy. You don't need to be in the same room as a therapist, but you do need to be able to see each other. So if you're looking for online psychotherapy for your agoraphobia, then do please go to my website and contact me and tell me more about yourself and what you've tried so far. And if you want to schedule online therapy with me, then simply tell me what times work for you, and we can then go ahead and set up a Skype therapy session. So I specialize in mindfulness therapy, which I talk about in my book, The Path of Mindfulness Meditation. Mindfulness therapy is very effective for working with emotions because we learn how to apply mindfulness-based consciousness to develop a conscious relationship with our emotions. That's the whole focus of mindfulness therapy. We learn how to develop a conscious and non-reactive relationship with our emotions, and this is what's most needed. Typically, we get caught up in habits of avoidance, distraction, and suppression. We try to push away our feelings, and that will not allow them to heal. It's only when you develop a conscious and mindful relationship with your emotions that they can ever begin to heal. Now, mindfulness is more than just consciousness, but it's a particular quality of conscious presence in which you are very aware but not identified with the emotion that you're focusing on. You're able to be present with it but not become overwhelmed by that emotion. You're able to see the emotion and you're able to see the reactive anxiety-producing thoughts that feed that anxiety, but without becoming caught up in those thoughts. So you can see thoughts and not become identified with them either. So it's developing this objective consciousness that's so important for the healing process. If you are not able to see your emotions and thoughts and memories and any other part of the mind objectively, then you basically become trapped by the mind. You become trapped in those patterns of conditioned reactivity. So we're learning how to see the mind without becoming caught up in it and without becoming reactive. The primary way that we go about working with agoraphobia is to set up a series of exposure challenges, and then to rehearse and train with each challenge before we do the challenge. So we imagine doing the challenge. We look for any anxiety reactions and reactive thoughts that may arise. And then we start working on changing our relationship to those thoughts and emotions from the habitual reactive relationship to one where we are mindful and conscious, able to stay present with those thoughts and emotions without becoming identified with them and without falling into the habit of continuing to propagate more reactive thoughts and increasing the intensity of the anxiety. It's only when you can stay present with the anxiety or with the thoughts without reacting that they then begin to subside and heal. So by staying present with them and not identifying or reacting, you're actually now strengthening that natural pathway of healing. And this is most important. So when you become reactive, you inhibit healing. But when you become mindful, you facilitate healing. It's very important. And this is the first stage in our recovery process. So we train with the anxiety habit before we do a exposure challenge. Then we do the challenge and we put that training into practice. We basically allow that training to take over and neutralize any anxiety reactions that may have been triggered in the past. It's only by training yourself out of those habits that you can develop freedom from those anxiety reactions. So we train, then we do the live exposure challenge, and we might train again with any anxiety that we notice during the challenge. And so we keep training and training with that anxiety, but using the methods of mindfulness. After we've successfully completed one of our challenges, we then move on to the next challenge in our list. And we work with any anxiety that gets triggered there. It gets much easier each time you do this. What you have learned from your training on the first challenge will make the second challenge considerably easier. And then what you learn from that challenge will make the following challenge to that even easier still. And this is how we basically progress. We move through our series of challenges and we gain momentum in developing consciousness and in neutralizing those anxiety reactions. The real problem is simply that anxiety is a habit. We get lost in conditioned reactive habits that operate subconsciously. But in the mindfulness path, we are developing more consciousness, so we're restoring consciousness, the consciousness that allows us to break those habitual reactive pathways. Another aspect of mindfulness that we use a lot is to develop compassion towards the anxiety itself. We develop a relationship that is not hostile to the anxiety, but rather one that's based on compassion. This is very important because compassion and love, which is underneath the compassion, is a very strong healing force. When you learn to love your anxiety, you are setting up the right conditions that will heal that anxiety. If you react to the anxiety with hatred, then you simply feed the anxiety, because hatred is itself based on fear. It's another form of anxiety. But love is not based on fear. It's based on consciousness. And so we focus on developing that as well. We learn to hold the emotion in our mind and basically embrace it with our full conscious, mindful being. This is what allows it to heal. Typically, unpleasant reactions like anxiety get isolated, they get shut out, they get suppressed, or we avoid them. So they're shut out, and that prevents them from, if you like, gaining access to the natural resources of your true self. But when we're meditating on our anxiety, we're doing the opposite. We are actually inviting the anxiety into our true self. The true self is a much larger space that's able to contain any content of the mind, any emotion, any thought, any memory, any perception. It's able to contain them all. That's why it's so powerful for bringing about healing. As you develop your mindfulness practice, you start to grow your identification with your true self, the one that is observing and caring for the anxiety. So your true self gets stronger. And your true self does not suffer. It is free from fear. It is fearlessness, the essence of fearlessness. And that, of course, is exactly what the contracted anxiety reactions need. They need connection to that part of you that is fearless. That's your true self. So that is what we are utilizing when we meditate on our anxiety. We're bringing our true self into connection with the little self, the anxiety, that needs that quality of fearlessness. And that's why the mindfulness approach is so effective. So I will teach you how to do all of this during our sessions together. If you'd like to learn more about online therapy using mindfulness to overcome your agoraphobia, then do please contact me and let's schedule a Skype therapy session. Most people see quite dramatic changes within the first few weeks of learning how to work with their anxiety using mindfulness. So please contact me if you'd like to get started. Thank you.